Although, quickly talking about the Murphy sign. The Murphy sign is basically a sign, a clinical sign that will be present if you have an acute cholecystitis. All right. So we have beautiful pictures, and we have the procedure to actually elicit this Murphy sign. Okay. At which part of the abdomen? How will you do it? And if you have a positive Murphy sign, what does it mean? All right. So we'll go from the definition. We'll also go to the procedure. Then we'll also look at what indications of a positive Murphy's sign. Okay, so let's move. We said the Murphy sign is actually a clinical sign that may be present in acute cholecystitis. And what is what cholecystitis? It's basically inflammation of the gallbladder. All right. So this Murphy sign is defined by inspirational arrest, that's stopping of bleeding. The pain is so sharp that the patient will stop bleeding for breathing for a while. Okay, so it is characterized by inspirational arrest or sudden pain in the right upper quadrant of the abdomen when the examiner palpates the right outer quadrant and the patient takes a deep breath. So do you understand? They're palpating what? The right outer quadrant. The patient is taking it. Do you understand? So to elicit this, to be able to elicit this sign, to see if the sign is positive, you basically ask the patient to lie on their back. This one is lying on his back. You palpate, that's gently press the right outer quadrant of the abdomen with your fingers. All right, gently press the right outer quadrant with your fingers. Now, ask the patient to take a deep breath. Now you should observe the patient's facial expression and breathing pattern. Okay, so that's just quickly it. Now, a positive Murphy sign is indicated by what? Inspirational arrest, that's stopping of breathing. Okay, so sometimes the stopping of breathing could just occur like that, or when you ask the patient to take in a deep breath, they'll find it hard to release it. Okay, there'll also be sudden and sharp pain in the right outer quadrant. There'll be guarding, that's muscle tension or rebound tenderness in the right outer quadrant. Okay, so this Murphy sign is thought to be due to the anatomical relationship between the gallbladder and the diaphragm. Now, when the gallbladder is inflamed, it irritates the phrenic nerve, leading to referred pain and inspirational arrest. Inspiratory, inspirational is still the same thing. Okay, taking in air. All right. So that's just what Murphy's sign is. Okay, and it's a sign that could be seen when the gallbladder is inflamed. Okay.